Hi, I'm Dr. Becky Coates with TMJ Plus Wellness Center. I want to review with you aftercare instructions once you have a tooth removed. So once you come in to have your tooth removal appointment, ahead of time, you would have already known things to prepare for your appointment, such as if you're going to do sedation, don't have a belly full of food in the morning, just water. Don't forget to take your blood pressure or diabetes medication that is necessary for your normal day. So don't skip that. You also might have been called in already aftercare medication or an antibiotic, which you should pick up prior to your appointment. That way that you are prepared. The day that you come in for your appointment, you are going to go home with a tray. A lot of people know what an Invisalign tray looks like. It's custom made. I would have 3D printed your mouth from a scanner called an iTero scanner. And this tray would have been to cover the missing tooth. And so you might say, oh, I've had tooth removed before, and why is that necessary? This is one of the extra healing and regenerative measures that we do in our office. For example, if you are having a tooth removed in this location, it's on the lower left side. So if this is the tooth that's going to be removed for different reasons, cracked tooth infection, and you are likely going to have healing measures there. You would have done ozone oxygen therapy. We would have done the ozone water in the extraction site to remove the bacteria. You would have had bone grafting and known about this already from your consent forms. You would have likely already had a blood draw, your blood, that day, if you choose to do that, to be able to use your blood to make a barrier or instant gum tissue. You can actually do that from your blood. So that's called a PRP membrane. You would have sutures to cover everything over like a blanket to seal it. How that's different from before. If you ever had wisdom tooth out and you got food stuck in the hole back there and you had to flush it out and it was stinky, this way you're not having food in the hole. You're having regeneration of the bone and tissue. All of this would have been on your consent forms again, that a copy would have been provided to you. So make sure and read those because they have key information. Please read those in advance very thoroughly. And also, if you have a ride, make sure your ride knows this so they know what's going on with you when they take you home, especially if you're sleepy. So this area here that's going to be healing, you would have had a custom tray. Looks like an Invisalign tray, very thin. Most people say, how thick is it? Look at it, very thin and slim. And the reason why you would have had this to cover the tooth area that's missing is because we want to protect biting on your gums or food, pieces of food. Imagine when you're chewing food, that's going to go everywhere on your mouth. It would make sense, right, to not have a piece of chips or meat, protein touching the gum tissue area, which would then possibly make a suture pop after all the hard work that we've done together with you. So that's why you wear the tray, and you're going to wear it all the time. Yes, I said all the time, even with eating. You're going to say that's probably different, kind of weird, but the reason is to protect you. So the tray would go over your teeth, snap in. Again, if you're going to snap in, use 2 fingers, right, left side. It's going to click into place. That way, when you're chewing, you don't have anything push on the healing area, the PRP, the bone grafting, the sutures, and it would protect this area. Now, you're going to have food get around it. It happens, right? So then after your meal, you would simply take the tray out, lift one side at a time. I would recommend you not lift on the side with the removal tooth. So for instance, lower left tooth is missing. I'm not going to push up on it first. I would push up on the opposite side first, then the left. Make sense? I don't want to push up on a graft or grab a suture. Very important to listen to that. So trays in, tray out, push up on the other side. And it will probably have tension. You're going to hear snapping. That's because it's tight, right? That's important. So when you lift the tray off, you're going to want to clean not just the outside part, but the inside part where it fits on your teeth, right? Clear soap, okay? Not bleach, not hydrogen peroxide, not essential oils, not toothpaste. Clear soap, okay? The reason for that is you don't want it to get filmy or white or stain, okay? The purpose of this is going to stay in there until your aftercare appointment, post-check appointment. And that could be several weeks afterwards. That would need to be made. Also, don't forget your post-care appointment. And what do we do at that appointment? We check the healing of the bone, the tissue. We take pictures of that. and we remove any sutures or barrier membranes that are left, okay? Also, key point, sometimes people have another barrier membrane, think of it a blanket or a cover for the healing area or the bone area. And the reason why that's left there, it would look white. It's a type of medical grade bone barrier and it will look white. Okay, so if you ever see that and you go home and you forget all the things that are said, that's why this video is very important. And also you're right to hear this, because if you have sleeping medication, you might have forgot some of the things and someone at home is taking care of you and they might question it. So really share this video with a person that's going to be helping you, your driver, okay? So a barrier membrane later at your post-appointment would be taken out if it was a white one, if you didn't do PRP or there was such situation that you needed to. And that has to stay there. Okay, so again, the key points about the tray, I think we went over that. And also, you sleep with this in, so your tongue doesn't rub things or mess with the sutures. Now let's talk about brushing. Most of our patients have some kind of electric rotary toothbrush, any kind of toothbrush, okay? It's a brand new one out of the package. So you're gonna be brushing your teeth, right? Again, let's pretend this area, lower left, is the one that's coming out. When you're having this vibrate and rotation mode of your toothbrush, when you come around this corner, turn it off. Reason being, we do not want to pop, catch a suture. We don't want to put tension on these lip folds that are right by the sutures. A lot of people forget that point. Imagine your bone in your teeth, in your root of your tooth is right where your gums fold. So if you're constantly, oh, what's going on, and you're opening your mouth and pulling on it, you're gonna pop a suture and you're not gonna think about how everything's connected. You're just thinking tooth. But remember these lip folds, a lot of times that's where the sutures are. And we have to remind our patients, if you really pull your cheek out to brush or you dig down, that may be causing a problem. So anyway, when you come around the side, turn the spin mode off and lightly brush your tooth. If this was me and I was missing this one here, I would just manually brush the top of the back tooth. I wouldn't dig in between. And I wouldn't dig down low because you do not want to pop a suture. So you don't have to come back again and you have to have another appointment. Okay. If I'm repeating this several times, there's probably a key point that we need to remember that. Same thing on the inside, tongue side. Don't go digging down through there. Remember, gum tissue is thinner there, just on the tops of the teeth. So best way is to look in the mirror, not just brush your teeth. Kind of like blindly in autopilot, like many of us do because we're busy with our day, right? You want to look in the mirror so you're getting it right. So that's about brushing. Second thing, you're going to go home with a rinse. It's a homeopathic rinse. It's called Tooth and Gums Tonic. There's no alcohol. It doesn't sting your teeth. It doesn't burn. Okay? Don't use scope, right? Or Listerine, burning stuff. That's not what we want. Many of you have this already belief and mindset. You are more biologically centered patients, and that's not something that you're going to do anyway. You're going to do this at least twice a day, morning and evening. On the instructions, it'll tell you a capful. It might seem like a lot or more intense kind of flavor. Start with a half cap. See how you do. Okay. You're going to want to swish for 30 seconds and don't do it like the guy in the commercial in the 80s where the guy would have the rinse his mouth and it would be overly aggressive. Just be real lightly. Okay. Imagine when you do mouthwash, sometimes people are really aggressive on your cheeks. That's tension. Watch out for that really lightly. So this is the rinse. You would take the tray out, right, to do the rinse. Just a key point on that one. Next thing you would have is called Pure O3. This is ozone gel. So ozone, you got to imagine, it kills viruses, bacteria, fungus, right? So why are we giving you this? This is a new tube. You're going to have to cut off the end, like here. Think of it like you ever scrape your knee as a kid and your mom back in the day, she might have put some ointment before she put a Band-Aid on, right? So you would heal, right? Think of it like that, but in the mouth. So the ozone is meant to help keep this tooth removal site clean. So you would put not the whole tray, just the area where the tooth was in the tray. That one tooth, lightly coat it. So you're leaving ozone there. It's going to have this olive oil taste. Just go with it. And then when you place it down in your mouth, think about it. You're leaving a clean layer of ozone over the extraction site. So that's what that is. This is plenty. So you're going to have stuff left over for this, and you can always use it for other areas in your mouth. If you had an ulcer, or you cut your lip, or you burnt your mouth on a hot cookie or things like that. So you'll have this left over. So in summary, key things, make sure and wear your tray. I explained to you the importance of that. We showed you how to brush around there and what to do with the toothbrush. We talked about the rinse and we talked about the ozone gel and your post-operative appointment. And please, again, read your consent forms. I know life is busy. That's why I'm making these videos to help you. But it talks about what to not eat, what to eat. Pay attention to that. It's very important so you can be successful. Thank you so much, and we look forward to seeing you next time. I'm Dr. Becky Coates.